I'm going to turn now to a couple of important health-related stories, starting with this one. More than 60 million people from Arizona to Florida are currently under an excessive heat warning. The Washington Post is predicting that Dallas, New Orleans, Phoenix, and Orlando will be among the hottest cities this week, with heat indexes as high as 115 degrees. The National Weather Service is now recommending people stay in air-conditioned places, drink lots of water, and wear light, loose-fitting clothes. Joining us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, great to talk to you again. It's been an extraordinary summer of heat around the world, but certainly here in the United States. What are some of the biggest health concerns as this record-breaking heat waves continues? And do you have any other advice to add as to how people should try to protect themselves?
Well, Jonathan, thank you for always highlighting this vital story, something that we need to be talking more about. First, the problem here. Among the highest risk counties, Jonathan, across the country on this heat wave, Southwest and Florida, we know 45% of individuals in those counties, that part of the country, are underinsured or uninsured. 18% are a high-risk senior population. That's important because we know that the most vulnerable are often the ones who don't have durable health care insurance, who don't have HVAC systems in their home. So things are going to get worse, particularly for that group here. What we've seen in places like Phoenix and places like Houston, to answer your question about health risks here, is the traditional rise in ER visits, upwards of a 50% increase, Jonathan, in certain places like Houston Methodist as a result of heat exhaustion, traditional heat stroke. But we're even seeing now new evidence that there's a link, very strong link, it appears, between prolonged exposure to heat and disease conditions like dementia that we previously didn't realize existed. There is even more research suggesting maybe there's a link between heat and aging, premature aging. The lots we still are learning.
Yeah, and we're going to have to learn, and learn soon, with these obviously growing impact of climate change. Dr. Gupta, the other, of course, health story we're following, COVID-19. Now, to be clear, this is not a surge this summer, at least not yet, like previous summers, but cases are up. Cases are up, hospitalizations are up across the country. So give us an update. But then secondly, tell us, as we head into the fall, what Americans should be doing. The young, adults, the elderly, what should we be doing in terms of vaccinations? What should we be receiving and when?
Well, thanks, Jonathan, for that tee-up. Critical to stay prepared for the fall and the winter here. Where are we? We're about 9,000 hospitalizations across the country from COVID-19. Let's give some context here. What does that mean? In January of this year, we're at 45,000. So we're 20% the level of the worst we've seen from COVID in year 4 of the pandemic here. So very different reality right now than, say, prior summers, 2020. And certainly in 2021, when it was a lot worse. Highest hospitalizations we've seen is over 100,000. So things are a lot different right now. So that's good. Well, we're seeing this new variant, EG5. We aren't talking a lot about it because, frankly, the existing vaccines protect against it. It continues to be more contagious, and so very transmissible here. Existing vaccines, though, still do work. When it comes to vaccines here, for you and your loved ones, for everybody watching, really important to recognize that the FDA is going to have new set of vaccines out against some of these newer variants, probably middle of September. If you are able, this existing evidence does suggest that if you're able to space out the vaccines, probably that might be the strategy here. That's what I recommend my patients. 2 weeks between vaccines, say flu and COVID. You can get them together. There's no safety risk if you were to get them together. But if you are able to space them out and make a few trips to the pharmacy or to a clinic, it is preferred here. A 2-week delay between the vaccines here, starting mid-September, though.
Yeah, and certainly we should, of course, keep in mind COVID still with us. And certainly as the fall arrives, I'm certain we're going to be talking about it more often, and we'd love to have you back. NBC News medical contributor Dr. Vin Gupta, thank you as always. We're glad to talk to you today.